All right. So I am delighted to introduce our next speaker, who, as I mentioned earlier, is zooming in from Australia. Eliza Bailey has been an oncology specialty nurse at the Peter MacCallum Cancer Centre in Melbourne, Australia, for about 10 years. More recently, she's embarked on specialty training as a sexologist with a desire to help cancer patients live their best sexual and intimate lives after treatment. I had the pleasure of hearing her talk at the New Zealand Australia Head and Neck Conference last August, and I thought she would bring a really interesting and different perspective to our symposium. This is one of the ones that I took to my patient advisory board to make sure they didn't think I was getting a little too provocative, so blame them, not me. But I think this is going to be a really fantastic talk. So we're going to turn things over to Eliza, and thank you again for joining us, Eliza. Really looking forward to hearing you speak again.
Thank you so much for having me. Sorry about the muting just there. And thank you for the lovely introduction, Heather. All right, let's start. I hope you've all had a really wonderful day. I'm going to talk to you about sexuality changes after head and neck cancer, and I'm really, really keen to learn from people as well what challenges they've encountered, what things that they've been able to do, what things they've been able to learn about living their life differently in terms of their sexuality after they have undergone treatment. So I'm just going to give a little content warning that I give for every single talk that I do, purely because every single person that is with us has had a different lived experience of what sex and sexuality is. And so sometimes these conversations, I apologise, can bring up some challenging memories or feelings. And so there is a rape trauma service line there for California. They have English and Spanish supports. There's two websites, intersex supports as well. So there's the Intersex Human Rights Council. And also I realised that I haven't got an LGBTQIA plus support service up there, but there are a number of them in California, and they are able to provide support if needed. And so today, what are we going to be talking about? I'm going to provide a definition of sexuality from the World Health Organization, because not everybody knows what sexuality actually is. I'm going to talk about sex positivity, which is a way that we can approach sex and our own sexuality and the sexuality of other people that we share ours with. Talk about the sexual response cycle and how that is impacted with cancer treatment, and then some tips, hopefully, for engaging in sex differently in a way that you would like to with yourself or with your partners in future, and a few resources. So, what is sexuality? And certainly thank you, Heather, for using the word provocative at the beginning of the introduction. Look, I use this picture particularly because it really shows a lot of joy. It shows that there's so much difference and variety in sexuality amongst every single one of us, and that it doesn't need to look like what we're taught it looks like, that everybody can be involved, and that it can be really fun and joyful and pleasureful, have people of any genders, and doesn't need to be just about penetration. And so I'll talk a little bit more about this. So the World Health Organization definition of sexuality is what I have just put there for you. It is quite a long one, but it's also referred to as a working definition because it is something that is updated depending upon changes that occur within humanity, really, and within sexual practice, because we know that sexuality is not just a singular static thing. It's an evolution. It's a narrative that runs through all of our lives and changes. And so what I also love about this is that it doesn't buy into a lot of the sort of overt and covert ideas that we have about who's allowed to have sex, and the reasons why we get to have sex or that we get to engage in pleasure. This really is a definition that doesn't listen to the trends, doesn't listen to different unhealthy ideas about sex and sexuality. It really is about supporting every single person to enjoy their sexuality and experience it in a way that is right for them, because that's what it's about. It's not something that just exists when we are with another person. It's something that exists inside us all individually. And then if we decide to, we can share it with somebody else. Now, sex positivity as a framework. Sex positivity is a term that is used really to describe a different way to think about sex and to really challenge the sexual narratives that we have been brought up with. And so, in terms of a sexual narrative, I'm going to use myself as an example, that when I think back about the way that I learned about sex was when I was in primary school. I had about 1 or 2 sessions with a bunch of other students who were all giggling and laughing because I think we thought that's what we were supposed to do, that's how we were supposed to respond. And the education focused primarily on biology, essentially, don't get pregnant, and that sex is about penetration, sex is for procreation as well, and there was not really anything about pleasure at all. There wasn't anything about consent. There wasn't anything about changes in your body and how we navigate that, how we actually have a conversation about these things. And also it was very focused on heteronormativity, which is a term that is used to describe the presentation sort of in media and in society that only couples who contain a male and a female are sort of accepted into the sexual world, into the social world. And so, I mean, heterosexuality is not normal or abnormal. It's just a really common thing. And there are a lot of other people out there in the world who are gay or straight or asexual or trans. And every person has the opportunity to enjoy sex in the way that they would like to. And so sex positivity also challenges the ideas about, I suppose, purely only young people wanting to engage in sex or being allowed to engage in sex and sexual activity, but also only healthy bodies or only bodies that look a certain way, because every single one of us has a different body. Every single one of us, it changes as we grow and it matures, and there are so many different things that occur, but it doesn't mean that we are, I suppose, out of the sexual realm, that we don't have continuing sexual desires. And so we don't need to know everything about sex and we don't need to know everything about sexuality, but if we approach it from a standpoint that every single person has the right to feel sexy, every single person has the right to enjoy pleasure in a way that they want to, that also helps have self-compassion for ourselves in relation to changes that occur in our lives, changes that occur in our bodies, and to explore it a bit more, to really begin with curiosity rather than the very minimal education, if people get any education at all, to open up to the idea that there's the capacity for change, there's the capacity for needs to be met. And finally, sex positivity focuses on education, really thorough education and advocacy for people to understand the changes that they're going through, understand the supports that they might need. And so it is a really fundamental way to, if you're a healthcare professional, to approach your patients, and just as a patient or survivor to maybe reconfigure the way that you have perceived sex and your body in the past. And so the sexual response cycle. This is an image that was created by Masters and Johnson in about the 1950s, and I will use it to explain a few different response cycles that I'm going to show to you throughout this talk. Essentially, what this shows is the physical changes that occur inside somebody's body when they're engaging in sexual play and penetration, if that's what they would like to do. And so what we're talking about is blood flow, if you've got a penis, getting an erection, if you have a vulva and a vagina, it becoming engorged, lubricated, ready to engage in sex, and then a period of time before somebody has an orgasm, which is a function of the pelvic floor muscles and all of the nerves in the area, and then what we call resolution, which is a period of the time after the orgasm. And so the reason I'm going to show this to you is because of this next image. It's because, and this might be a little bit challenging to see, so I will talk you through it a little bit, but these are all of the changes that can occur in cancer treatment or after cancer treatment to that cycle. And so if we think about right from the beginning in terms of desire, the way that somebody feels about themselves mentally and emotionally can really change. The way people feel about their bodies can really change. This can really impact somebody's desire and drive to actually engage in sex, as well as other symptoms that people can be going through. Having a dry mouth, worrying about any tongue changes, anxiety, nausea, and certainly hormone imbalances. If you're somebody who's undergone chemotherapy, which I'll talk about a little bit more later on, all these things can really inhibit the way that people feel about wanting to have sex, which can close down the sex drive. And then further on, if we think about the change in hormones, all of those feelings impacting if we're going to engage, then there can be anxiety, there can be changes in the penis and the vagina, mainly from blood flow and chemo again, if that's what you've undergone. But again, anxiety plays a role. And if there is also previous sexual dysfunction, that can create a little bit of a challenge as well. But there are just so many areas along the pre-existing natural physical response that people would have had that have been impacted by cancer treatment and cancer side effects. And so sexual side effects are a really, really common area of treatment, but they're just not talked about nearly enough. And I'm sure I don't really need to tell any of you that. And so in terms of engaging in sex in a different way after treatment, I know that I have talked a little bit about the vulva and the penis, but they are fundamental in the act of sex for a lot of people. So I did want to bring that to the forefront as well. But we really need to consider our entire bodies. And so mental and emotional health is a really, really fundamental part of the way that we engage in sex. And sometimes it's not prioritized as much when physical treatment can be prioritized or needs to be prioritized. But it certainly guides the way that we interact, guides the way that our body feels as well. And feelings of anxiety and stress are actually going to have a direct impact on your sexual hormones. And so the more stressed you are, the less likely you are to have a desire to engage in sex. It's also really important to consider feelings of grief, grieving about the things that your body used to be able to do and the things that you would like it to be able to do. If you really enjoyed giving oral sex to your partner and you can't do it in the way that you used to anymore, if your orgasms aren't as intense because of treatment that you've undergone or because of being on mental health medications, if you just can't engage in the way that you used to be able to, it's really natural it's very natural really for people to try and ignore it. That's a really common thing, but really give it some space, allow it the time that it needs to acknowledge that, yes, this is a change. I do miss that I used to be able to do this. But then the next step can be to consider that there are different ways, there are different things that I can do, but it's just about learning about that. And so in terms of other parts of our body, blood flow is a really, really important part of healthy sex in terms of lubrication, in terms of erections, and so making sure that you've got a general level of fitness, that you're stopping smoking because that affects the blood vessels as well, and considering other medications also that might impact that. And so hormone levels. So estrogen and testosterone are the prime hormones. So testosterone is for people who've got a penis, and estrogen is for somebody who's got a vulva. And so while each of those hormones exist in both of our bodies, the estrogen, as I said, is primarily for somebody with a vulva. And so these hormones, though, can be really impacted by chemo. And again, I know that not every single person has had chemotherapy, but this is something that's predominantly talked about much more in the breast and gynecological and colorectal cancer space, and it does need to be acknowledged for all of our people, all of our patients and survivors that are having chemotherapy. And so these hormones are really fundamental in creating the desire to have sex, preparation for the body, so lubrication of the vagina, gaining and maintaining an erection. And so they can be really significantly affected by chemotherapy. And so acknowledging that and taking that into account is very, very important. And considering use of lubricants. I'll give you a few more tips next as well, so that we can talk through those. But there are certainly body changes from the cancer and cancer treatment, but also changes in our body as we get older as well that can affect the way that we engage. Another one that I didn't put on there was fatigue, which, again, really fundamental and can be a long-term side effect. Maintaining, again, physical fitness to the best of your ability, engaging in consistent physical exercise. The sex can be the physical exercise if you'd like that to be the case, but doing it in a way that supports you to not be exhausted for the next few days. And so if you find that you've got most of your energy in the morning, then you can schedule your sex at that time. Sometimes it doesn't feel sexy to schedule in your sex, but it's really about working with your body and how it is functioning. There are also different positions that you can use, so that you can be lying down, using body pillows as well if you've got pain in different parts of your body, and considering also any other side effects. There are different positions for nausea, making sure you've had medication beforehand, whatever it is that you need to support yourself to engage in that way. And so this is the final sexual response cycle I'm going to show you, but I really appreciate it because it isn't purely about physicality. It also acknowledges different sexual desires that occur naturally in people, and that certainly sexual desires change after cancer and cancer treatment. And so what I've got there is spontaneous and responsive sexual desire. And so there can be a common sort of perception. It's one of those another unhealthy behaviours that exists in society, that people are ready to go to have sex all of the time, or that you should be ready to go. That means that you're interested. That's how your partner or your partners know that you care about them. But not everybody has a spontaneous sexual desire, and so it may be that you don't necessarily feel like engaging in sex, but that your partner or partners approaches you. The process begins, and you think, oh, actually, this is building. I do feel like I would like to engage in this. If this is the kind of desire that you think that you have, and you would like to engage with your partner, and you would like to initiate, you can be really useful to spend some time with yourself beforehand, checking in with your body, doing a little bit of masturbation, reading. There's some really lovely erotic media on the internet as well. And it allows you to really drop down into your body and understand whether you do really feel like engaging at the moment, or if actually I might just try tomorrow. I might not be up for it at the moment. But so it gives you that sexual stimuli that can really support you to um, to engage in pleasure. I love that it has emotional and physical satisfaction and emotional intimacy as well, because as we saw from the definition of sexuality, it really is a full body experience. It's our thoughts, our feelings. It's not just a sexual response, not just a physical sexual response, and certainly uh, arousal times for somebody who has a vulva and a vagina is a lot longer than somebody that has a penis. Not always necessarily, but commonly it actually is. Certainly, as well, if somebody has been through menopause or they've had menopause induced from chemotherapy, it does take much more time for the body to get ready for penetration, if penetration is what you like. And so, really engaging in um, checking in with each other emotionally and nurturing each other and supporting each other, that, you know, sex is not just what happens in the bedroom or what happens in that one, you know, short period of time, that it really is about building on caring for each other, nurturing each other, and leading into something lovely. It's not just we're living our daily lives and then we have sex and then we keep going. It's a sort of continual nurturing. And so, as I said, preparation, lubricants. I'll talk to you a little bit more about useful lubricants next. Any devices and toys that you might like to use, because there are plenty that are available and can be really, really fun and really interesting. Any clothing or that you might like to wear if you feel self-conscious about your body, that's absolutely fine as well. And I've got a timer because I always go over, so I've just got it next to me. That's why I keep looking at it. And so also focus on pleasure. It's really, really useful to focus not just on an orgasm alone, or not just that, oh, I need to have sex because that's my responsibility, or whatever it may be, but thinking about pleasure can really change the way that we engage with each other, because we're thinking about, I want to enjoy this as much as I can. I want my partner or partners to enjoy it as much as they can. How can we go about doing that? And that creates creativity, curiosity. It creates a space to try a lot of different things as well. And so I've got a few more little tips here. And so, as I said before, having a healthy body sort of inside and out, communicating with your partner or partners in whichever way that you would like to, flirting with each other, you know, using love letters, sending pictures to each other if that's what you would like to do. The traffic light system that I've got written there is basically if you're trying something different, or at any time during sex and you're not sure, or you want to communicate to each other how things are going. And so green is good. Yep, absolutely. You know, go ahead. Yellow is, oh, maybe, I'm not completely sure, but let's just keep on trying. And red, absolutely stop. And so this is a really simple way to communicate with each other and then talk to each other about it afterwards as well, if something is a problem or not feeling right, or to change something up. And just because something felt good on one day doesn't mean that it's going to feel good on another day, or that you're going to feel like doing it on another day as well. And in terms of new partners, people really choose to approach this differently. Some people like to say it straight up. Others prefer to take their time. It can be a bit challenging as well. Obviously, head and neck is an area that's really visible to the rest of the world. So some people, it might be obvious from the beginning, and that's absolutely all right as well. But practicing having those conversations, because, I mean, they can be confronting and challenging. So I've said toys. That picture there are a few different little toys from a brand called Iroha. They're really lovely. They're nice and sensory as well. But there are lots of different types of toys that you can use, and things that may be able to not completely replicate, but mimic the things that you used to be able to do with your partner. As I said, practice and preparation. If you're trying something new, practice. And it is really challenging to feel like we might have gotten something wrong, or we might not understand something, particularly when we feel as vulnerable as we do when we are having sex. But if you think about the fact that there's generally been very little education for people throughout their lives. There's a lot of pressure to be really good or to get it right, but to create some space in there for you to have fun and to get things wrong and to learn with each other. Preparation, that's foreplay, massage, talking with each other, whatever you would like it to be, and certainly lubricants. Vaginas, after they undergo chemo or after they go through menopause, they change a little bit. And so it means that they are sometimes a little bit more susceptible to different infections, such as bacterial vaginosis or thrush, and urinary tract infections as well. And so there's a brand of lubricant called Yes, which is a very, very good quality brand. You really need to have something that is going to support your vagina and your vaginal tissue, because while there are lots of lubricants on the market, not all of them are very good quality. And you really want to consider that it is a medical product that you're going to be putting inside your body. And so this has a viscosity and thickness and makeup that will make sure that there's not too much fluid put in and there's not too much fluid taken out to preserve the vaginal tissue, because otherwise what can happen is while the lubricant lubricates, it causes a lot of breakage in the tissue, which can cause more pain, more possible infection, and can sometimes cause some bleeding. And some people also like to try coconut oil, which I very strongly recommend against, because that can cause infections as well. So as one of my sexuality colleagues says, keep the kitchen out of the bedroom. And so just a few little resources there. These people specialise in sex and cancer. Amanda Hordern has some books and a website. Anne Katz is in Canada. She's also done some wonderful books and has a podcast. Testevez is Australian. They have a website and a few different masterclasses on the vulva, penis, and also intimacy, regaining intimacy after having cancer treatment. They've undergone cancer treatment themselves, and they're the author of a book called A Better Normal. The others there are sort of sexual health information, but also I put at the bottom there just some self-compassion teachers. And so Tara Brack and Kristen Neff are people that you can find on YouTube, really just to nurture and support your body and nurture and support your soul. And certainly if we don't appreciate our body and we don't, and we tell our body that we don't appreciate it, it's not going to engage in pleasure in the same way. And I think that is the end of my talk. Thank you very much. I really hope that was useful. If you have got any questions, feel free to email me. If you have got also any suggestions on great oral lubricants that you've been able to use, I would absolutely love to hear about them, and anything else that you've been able to do if you feel comfortable sharing it with me. I'm also going to go to the World Association of Sexual Health Conference in June this year, and so if I learn anything else, I will send it through to Heather.